thrilled that you're all joining us today for this amazing webinar. You know, one of the things I've said many times throughout the course of the epidemic is that leaders lead. And today we're going to hear from a leader who really has led in an effective way. By the way, simultaneously, as we're having this webinar today, there's this really problematic, awful Senate hearing going on where like Rand Paul is going after Fauci like nonstop. It's like it's completely awful. So fortunately today we have a leader who actually understands science, and I'm honored and thrilled to present Mayor André Sayegh, who is the mayor of the city of Paterson, who's going to be presenting to us about the vaccination rate in the city of Paterson. The title of this talk is the 94% vaccination rate. Here's how we did it in Paterson. Throughout the course of this pandemic, I have been one of the mayor's biggest cheerleaders, and because of the work that he and his team have done, they have effectively implemented public health. And it is so important for all of us to like really think through what is happening on the ground, not to disconnect the academic public health from the real public health that's happening, and marrying those efforts to continue to improve the health of people and populations. So let me do the formal part, and then I'm going to turn it over to the mayor because I'm feeling we have an amazing hour together. So the mayor will draw from his experience as a first-term mayor to discuss ways in which the city of Paterson, an immigrant community of 57 nationalities that has historically dealt with health inequities, responded to the COVID-19 pandemic. He will share lessons learned on the importance of utilizing diverse approaches to best reach all of the city's various communities. André Sayegh assumed the office of mayor of Paterson on July 1st, 2018, focusing his administration on issues that resonated during his campaign: stabilizing property taxes, improving public safety, and driving economic development. He has continued to make improvements to the public parks, a priority for now gearing up the 2020 census. The mayor is determined to inspire a renaissance in the third largest city of New Jersey, driven in part through tourism and economic development around the city's greatest natural resource, the Paterson Great Falls National Historical Park, which I obviously need to see. Mayor Sayegh served on the Paterson City Council from 2008 to 2018, where he helped establish a more business-friendly and family-friendly Paterson. As councilman for the 6th Ward, he advocated and successfully revised the flood maps so that his constituents no longer had to pay for unnecessary flood insurance, an important thing during this climate change drama we're going through. He closed down 9 nightclubs, transforming one into a preschool in underserved neighborhoods. I love that so much. He introduced an abandoned properties ordinance that reduced the number of eyesores in the city, while also building a new playground in the Lakeview section through private partnerships and the national nonprofit Kaboom. Sayegh introduced the commercial curfew ordinance that significantly reduced crime in Paterson's hotspots, and championed the work of the City Environmental Commission to increase Paterson's recycling rate, generating revenue for the city budget. Mayor Sayegh graduated with his highest honors from Seton Hall University with a bachelor's degree in history. He earned a master's degree in public policy and administration from Columbia University and served as president of the student government. He remains an adjunct professor at Passaic County Community College. Maybe we should be thinking about Rutgers School of Public Health, where he taught for 19 years. And served as the director of the job readiness and customized training. Prior to his election to the city council, he served on the Paterson Board of Education, the chief of staff for the state senator, John Gigenti, and a field representative for Congressman Bill Pascrell. Paterson is the only home André Sayegh has ever known. I love that. He is born and raised in the city, where he now raises 3 children, 2 daughters and a son, and his wife, Farhana, is that right, Mayor?
Very good.
That's all right.
Harry gets points.
Excellent. Welcome, everyone, and Mayor André Sayegh. Welcome, my friend.
Perry, thank you for that gracious introduction. I couldn't have written it better myself. And we will get you to the Great Falls. As a matter of fact, if I can use that as a pivot point, today we were there at our National Historical Park because proudly the American Planning Association selected the Great Falls as a great place in New Jersey. So it'll only serve to incentivize others to come and visit. And we picked today to make the announcement because, fittingly enough, the founder of Paterson is none other than, well, it's not your friend, Perry, you know Lin-Manuel Miranda, but Alexander Hamilton, who Lin-Manuel Miranda made famous. And so we had a cake in honor of his birthday. Take a look at this. He'd be proud, wouldn't he? I'm talking about Lin-Manuel Miranda. Nevertheless, I'll put that.
I want cake.
You can't have your cake and eat it too, Perry. Well, in Paterson, you can. But nevertheless, it is an honor to join everyone today. Yes, I'm a proud alumnus of Seton Hall University, just like Dassel, our public information officer. But I root for Rutgers in football, not in basketball. Sorry, guys. Sorry. I have to be very honest with you. Speaking of being honest, since we scheduled this, Paterson's vaccination rate now is 99%. So let me just put everything in a perspective, because Perry, in Paterson, in God we trust, and in Fauci we trust as well. We understand and respect and appreciate the science here in this city. And we're at 99%. We actually had a friendly competition with Trenton, and the commissioner, health commissioner, who needs no introduction, Judy Persicilli, presided over the competition. And this was last year, where we stated whomever had the highest vaccination rate at the end of 2021 would have to send food to the city that didn't win. And so this Thursday, Judy Persicilli will be in Paterson, and Trenton will be sending us jerk chicken from one of their Jamaican restaurants. So I'm saving my appetite. But the 99% is adults 18 and older with at least one dose. So we have to keep pushing. I myself got the Johnson & Johnson, but then I got the Moderna booster. But I'm so much of a devotee of these vaccines that if they said I can get Pfizer, I'll get Pfizer. I'll get all three. I could be like a test case. And if I start growing horns on my head, you know what happened, Perry. But
you know, Mayor, I just keep walking around the office saying, shoot me up with some little more mRNA right now. Come on, let's go. Come on.
Do we just become best friends?
Yes, we can't. We're already becoming best friends. That's happening as we speak.
We already established that. So nevertheless, I want to put into perspective as far as Paterson is concerned. We are one of the most densely populated cities of any municipality with 100,000 or more people. During the latest census, which we did very well with, we saw a 10% increase. We're at 160,000. So that makes Paterson, New Jersey's newest first-class city, because any city in the state over 150,000 is classified as a first-class city. So that's us. But the problem is you shoehorn 160,000 people in 8 square miles, and that could be a recipe for disaster. New York City is the most densely populated. Paterson's right there with them, with any municipality with 100,000 or more. So what we saw, and we were nationally recognized for our contact tracing program, what we saw when you had a family of 12 people living in a house, when one person got infected, as much as we try to isolate them, everyone got infected. So you had 12 cases. Because quite frankly, if you want to think about socioeconomics, there are families in Paterson that cannot afford to isolate or quarantine because they're sharing a lot of common space, bathrooms, they don't have a basement. So when it spreads in Paterson, it really spreads. So if one person in 12 gets it, they all get it. One family, one person out of 8, they all get it. So that's to put everything in a perspective of what we're up against and why we really had to put, or should I say, we made the Paterson push to get the vaccine. And so saying that, will segue into my presentation as far as what we did to get to not 94% now, 99% vaccination rate. And if you don't believe me, you can trust but verify. And also the way I look at it as well, in God we trust, and Fauci as well, but everybody else brings the data. So I'm going to bring the data. So let's talk about what we did early on. Look, we started vaccinating December 28th of 2020. So once we got the green light, we said, okay, let's just open it up. And at our division of health, the first person to get vaccinated who was eligible, I would have done it, Perry, but I wasn't in the category early on, was our public health officer, who's shown tremendous leadership. His name is Dr. Paul Prasad. So we started vaccinating early. And then accessibility. We not only had it at our division of health, we eventually evolved, and I'll elaborate a little later, at one of our schools. So we had a mega site. It was a point of dispensing at International High School. And we did not discriminate because this virus does not discriminate. So at first we were told, well, you know, you got to only vaccinate your residents, Paterson residents. We're like, wait a minute. COVID-19 doesn't know boundaries or barriers, and neither should we. This is a global crisis, and it's a humanitarian effort to make sure that we vaccinate as many people as possible. And we have partners in health, which I'll elaborate on as well, with St. Joseph's Health, We had the faith-based community stepped up, the nonprofit organizations stepped up as well. And then we utilized influencers. I'll elaborate on that later. People in the world of athletics, entertainment, education. And then we really, really put the full court press as far as the press is concerned by maximizing the media. You got to get word out. I'm a proud participant in the Bloomberg Harvard City Leadership Initiative. Every year, Bloomberg Harvard City Leadership Initiative, they select 40 mayors around the world to participate in a cohort. I think they're on their 8th cohort. I was in the 2nd cohort. We had the mayor of Atlanta, we had the mayor of Seattle, Miami, San Jose, and little old Paterson. And during especially early on, throughout the onset or during the onset of the pandemic, we had regular sessions with our Bloomberg partners. Over hundreds of mayors were participating because this is uncharted territory for all of us. It's a once in a century crisis. And what they emphasized was communication, constant communication, telling the truth to your residents, hoping to at least instill some confidence that the situation will improve. You've often heard, and it is probably a trite refrain, we're in this together, but it's true. We're in this together. And I tell we're in this together. I'm going to win this together. So let me tell you how we're winning as far as the vaccination rate is concerned. So we vaccinated early. See, that's a glimpse of our point of dispensing. That was at International High School. Paterson had what you call a mega site, and we saw hundreds of people within hours. And originally, the state asked us to use the appointment system online. And we said, wait a minute, I don't think that's going to work. That's not going to work. Some people, there's a digital divide. Some people in Paterson don't have access to the internet. We have senior citizens. They're not going to go on. And quite frankly, with all due respect, the state appointment system was plagued by problems. And people were waiting not hours, sometimes days, and even weeks to get vaccinated. So we couldn't wait. So we said, you come and we will vaccinate you. First come, first served at our pod. And we have anecdotes. I'll tell you why we did not turn anyone away. There was a line. It stretched out. I mean, people were lining up the day before and waiting hours for us to open at, let's say, 9 a.m. Some people were there as early as midnight. And we had a gentleman who was 95 years old. And he said, Mayor, I don't live in Paterson, but I want to live. So what do you say to him, who's probably waited several hours online, 95 years old, and no one else would take him at that time? He couldn't get an appointment through the state appointment system. And quite frankly, like he said, I just want to live. And so we cannot turn anyone away. Like I said, if we're in this together, we're really in this together, and it is a global crisis, and it's a humanitarian effort on our part. So we were at the pod, our point of dispensing at International High School. Obviously, we had to take care of our first responders, police, fire, healthcare workers. And like I stated before, we had an open door policy. It got to a point, like we were taking anyone that lived in New Jersey, worked in New Jersey, went to school in New Jersey. We were taking, but then it went beyond that because Paterson and Perry was talking about, we have 57 different nationalities. I think it's gone up almost by 13 more. We have like 70 nationalities, I believe, since we last spoke. But we had people come from Peru where they were having problems. We vaccinated them, irrespective of whether or not they were citizens. And we were not asking people if they were citizens. And if they weren't citizens, they were residents with a green card, we took them too. And I worked those lines. So I knew that there were people that were not citizens that were online, and they were coming from Peru, they were coming from Dominican Republic. We have a large Latino population. In fact, our population is about 62% Hispanic. So we couldn't, like I stated before, we had a moral obligation to vaccinate whomever was online, irrespective of their status, citizens or non-citizens, undocumented individuals, we could not turn away. So that was our open door policy. Now, accessibility. In this photo, you'll see it's me, obviously. I'm sorry you have to be subjected to that. But you have a few other, that's our public health officer at the microphone, very adept, capable. But those are 3 mayors of neighboring towns. So we have contracting towns. So we have Total, which is a very small borough. You have Prospect Park, an even smaller borough. You have Hawthorne, not as small, but still. And we have North Haledon. So we told them their residents can come. Just encourage everyone, their employees, anyone whomever is eligible, come, meaning age, eligibility, if there was people with underlying health conditions and they needed priority, we would prioritize them. But I also want to emphasize the fact that we weren't just situated in one location. We realized that there were hard to reach residents. So we got mobile units. We got these mobile units and we placed them in strategic locations where we knew the residents were hard to reach. And we were up against vaccine hesitancy. That was real. And I'll elaborate on that later. But what also helped was that we had all three vaccines. We had Moderna, or we still have Moderna. We still have Pfizer, and we had Johnson & Johnson. So whatever people like, it was almost a la carte. Whatever you like, you can pick and choose from the menu of vaccines. And quite frankly, some people just want the Johnson & Johnson, even though it was statistically proven not to be the most effective. I think it was like 72%, the last data I looked at. They were like, you know what, I just want a one-shot deal. So that's what we did. But most people wanted Moderna besides that. Like as far as anyone who wanted 2 doses, they wanted Moderna, but that was a 4-week wait, whereas Pfizer's only a 3-week wait. And then shipment. Our public health officer, myself, we were on the phone with the governor's office consistently. Every day, like, when are we getting our shipment? If you give us the vaccines, we'll get the job done. Like that was a paraphrase, former Prime Minister in England, Winston Churchill. If you give us the tools, we'll finish the job. Because we believe we're at war. And we're at war with an invisible but not invincible enemy. And our best weapon against this enemy, this virus in the war, is the vaccine. There's no doubt. And our healthcare workers were working around the clock. I feel really badly. They haven't rested for 22 months. Think about this. Some have been able to, I mean, they were willing to forego a vacation. I mean, in addition to the contact tracing and the testing and the vaccinating, now the boosting, they've done an awful lot, and we'll be celebrating them when Trenton comes up with the Jamaican jerk chicken on Thursday. And we're also, this Friday with the hospital, we're going to have a healthcare heroes parade. We're going to have a parade in Paterson to celebrate the essential work of those frontline warriors that have helped. And so if I could just elaborate a little bit more on the mobile unit, we repurposed a unit that we use for HIV AIDS testing. And now it's for COVID-19 testing and vaccinations. Last week was Three Kings Day. I talked about a large Hispanic population. In Latin America, Three Kings Day is almost as popular, if not as popular or more popular than Christmas. So outside of City Hall, we were giving out gifts for Three Kings, for the Three Kings Day, but we also gave out KN95 masks, gallons of hand sanitizer. This is what we were giving out. This mask, this hand sanitizer. And then we also had the mobile unit outside of City Hall for anyone that wanted to get tested, vaccinated, or if they gotten vaccinated, getting boosted. So like I stated before, we made the vaccine as accessible as possible and no excuses. Got to get it, because you've seen now with this Omicron variant, it is rapidly transmitting. It's infectious, it's highly infectious, and we're seeing our daily infection rate skyrocket. In fact, last week we had 800 new cases in one day. We've never seen that throughout the pandemic. That's double what we saw last year. And it's because this is highly transmissible, this variant. And we get reports all the time. There are metrics that we monitor. For example, the hospitalization rate, besides the daily infection rate, which we monitor, the metric we monitor, but the hospitalization rate, it's still lower than what it was at the peak of the pandemic. But I will say this speaks to the efficacy of and the safety of the vaccine. 60% of those in the hospital, I spoke to the CEO yesterday of St. Joe's Health, 60% of those hospitalized are not vaccinated. So when they say this is a pandemic of the unvaccinated, yes, there's merit to it. And then about 30+%, they are under vaccinated. So you're talking about people maybe with 1 dose of Moderna or Pfizer, or maybe not boosted. And then about 5.8, maybe 6% are fully vaccinated, boosted, breakthrough infections. And sadly, we have people who are not vaccinated that are on ventilators right now. So people are still dying. We have not put this pandemic behind us. I really am irritated when people say, yeah, it's over. It's far from over. We still have our work cut out for us, and we still have to vaccinate, even if we're at 99%, because we got to boost people as well. So that's why I want to shed a little bit more light on what we did as far as the accessibility is concerned. Because we have a homeless population. We have a large homeless population. And quite frankly, they're not going to come to us. So we went to them. So we were going to shelters. We'd go to places like Eva's Village. In this picture, that's Good Shepherd Mission. We went there with the Johnson & Johnson because we feel like it's probably more efficacious to go there, vaccinate the folks, and not have to worry about going back. And people were really, really appreciative. You know who else was profoundly grateful? Homebound, bedbound residents. We went in there, Johnson & Johnson, and that was featured on a number of news networks because we were one of the first to start doing that. But then one of the most vulnerable populations, senior citizens. So we went into there are several senior citizen sites, housing sites in the city. And again, we'd go in there with Johnson & Johnson. And if people made a request, I mean, if they wanted Moderna early on, we were getting Moderna, especially when we didn't have Johnson & Johnson. That came a little bit later. And then we went into, like I stated before, our contracting towns, Hawthorne, Prospect Park, Totowa, and North Haledon. And now, the big push is for boosters. That's why we'll have the truck outside of City Hall. And 6 days a week, it is all over the city. And I will also elaborate a little further, besides the accessibility, about some other strategies that we used as far as getting that vaccine to those who are most in need of a vaccine, and who we recruited to help us get there. So I want to elaborate a little bit further on that. So our partners, that's Judy Persicilli. That's when we announced the vaccine challenge with Trenton, and that's on the far right, our president, Kevin Slavin, who's been a partner in this whole pandemic, during this pandemic. And St. Joe's, we couldn't do without them. They have a drive-through as far as testing is concerned. They vaccinated as well. But we also recruited, besides having St. Joe's, we have Paterson Public Schools. We couldn't do it without International High School serving as a point of dispensing. And then St. Joe's opened up a point of dispensing at one of our schools, Dr. Hania Wadullah School. They opened up. And then St. Joe's was doing the testing and the vaccinating as well. And then McDonald's, we were incentivizing it, right? Get immunized and get some fries, or fries for getting immunized, something along those lines. I don't know if anything rhymes with Big Mac, but I don't think anyone got that for getting the vaccine. But nevertheless, McDonald's, we wanted to incentivize getting boosted, getting vaccinated. Shifa Pharmacy, incredible. Dr. Jabeen Ahmed, couldn't do it without her. She's still on the front line. She's doing home visits now. So she's doing the bedbound. She's doing anyone who's really sick. She'll go in their house, test them. And if they need the vaccine, she gets the vaccine to them. She's doing God's work. She's a saint, Dr. Jabeen Ahmed. And then, like I said, Partners in Health, we've been competing. It's a friendly competition with the city of Trenton. So that's helped us as well, partnering. But I want to elaborate a little bit more on more partners that we have. And these are influential individuals. When I talk about vaccine hesitancy in Paterson, it was legitimate. There's no doubt, especially early on, what I observed, and then it was borne out in the data, African-American men were really hesitant about the vaccine. And we were pointing to the tragedy at Tuskegee. We were pointing to just a general feeling that you can't trust the government or putting anything, foreign substance in your body. So we recruited influential African-American influencers, or should I say African-American pastors. That's a pastor right there, Pastor James A. Kuykendall. So he brought the faith-based community, that's clergy behind him. So he brought them, and with their clergy comes their congregations. So now you got scores of people coming who were hesitant at first, but now because their pastor, who's trusted, tells them, look, you have to have faith in this vaccine, it'll save your life. It's true, because that man right there, him and his wife almost died. They got COVID early last year and spent several days in the ICU. And he was a success story, and it was remarkable. And then he shared not only his story, but shared his conviction that people have to get vaccinated. It is our best defense against this virus. But we also recruited people from the world of sports. We recruited people from education. And like I say, the clergy. So that picture there, that's Monsignor Gino. He's the rector at St. John's Cathedral. He opened up his church. His cathedral became a pop-up site. Within 2 weeks, they vaccinated about 3,000 people. And then they said, look, it doesn't matter if you belong to our church or not, as long as you are eligible, come, we'll vaccinate you. So we rewarded him, Monsignor Gino Silva, for being the humanitarian that he is. And we also had Pastor Randall Lassiter, Calvary Baptist, the historic Calvary Baptist Church. He opened up the doors of his house of worship, and we had over 4,000 people get vaccinated there. And we awarded him as well. But then we got athletes. I'm pictured there with David Tyree. I'm sure you know him. If you're a Giants fan, you remember his memorable helmet catch. If you're a Patriots fan, you remember that too. But for different reasons. So David Tyree and other NFL players like Roman Oben, former NFL players, Dave Zott, they came to Paterson. They helped push the vaccine. A dear friend of mine, Harold Reynolds, who was an all-star with the Seattle Mariners, now he's on the MLB Network. He and I filmed the commercial. And you want to talk about Hamilton? Well, one of the famous scores or songs in the musical was "I Am Not Throwing Away My Shot." And so that was my commercial, because in the commercial, I got the vaccine. And I said, I'm not throwing away my shot. And Harold Reynolds said, and neither should you. That commercial is still airing on LT's Cablevision. And we're going to keep doing it. People have told me, Mayor, I came to get vaccinated because I saw your commercial with Harold Reynolds. Leonard Marshall, he was a Pro Bowler with the Giants. I recruited him. We had a press conference that featured him and his family. And it was all about like just assuaging, allaying any concerns. Legitimate. The hesitancy was there. It still is there to an extent. But I think with this Omicron variant, people are becoming more mindful that, listen, if millions of people are getting vaccinated and they're still alive and they're doing well, then it can't be that deadly, or at least it's not that much of a risk. And I try to emphasize that. I record robocalls on a regular basis to my constituents to let them know where the mobile unit's going to be, or where we're going to be testing, the Division of Health, if we've opened up a pop-up site, or if we're partnering with organizations like, for example, urgent care centers to offer the vaccine, offer testing. We let them know that as well. So communication with their community is critical, especially at a time like this. People just needed information. Because like I stated before, there's so much uncertainty, and uncertainty creates anxiety. And then anxiety breeds anger. And you don't need that in your community. You need to reassure your residents that we are going to endure this hardship and we're going to emerge safe from it, and hopefully stronger as a result. That's why very often when I punctuate my robocalls, I end with stay safe, stay strong, and stay informed. You need to know what's happening as far as real-time information is concerned. And so we're proud of our partnerships and the fact that this has been a collaborative effort or a humanitarian effort. And we're going to continue to do that in the city with clergy, with community leaders, with athletes. And so that's why I think that's how the path out of this pandemic, like I said before, is through this vaccine. And we're just going to keep emphasizing it. And we're not satisfied. Complacency is the enemy, right? So we're not satisfied with 99%. We got to get 100%. And then we got to get boosters in people's arms as well. And so I feel like because we took this virus very seriously in our city early on, that's why we're here. And that's why we want to influence, or should I say, inspire other municipalities that may be a little bit hesitant, especially in Southern Jersey. For those that still don't want to get vaccinated or don't believe that it works, it does. I can testify to that, but there are many more testimonials in a time when we're being tested, right? So that's why I always say to people, we've been tested, and it makes for a better testimony. And so here we are at 99% with this new variant. I'm fairly certain we're going to get this out of the way relatively soon, and that's by getting people vaccinated and getting people boosted. Now I see Pfizer is going to have an answer for Omicron. So I have Johnson & Johnson, I have Moderna, and maybe I'll get Pfizer as well. Like I said, I don't mind being a test case as long as it's effective and it inspires others to do so. So I'm just honored to be able to share this information with you, especially like how we put the full court press on the press, Perry. And that was an alliteration, full court press on the press, Perry. And yeah, we had regular press conferences. And like we often said, we were getting big bites out of this because almost every major news network, News 12, Fox 5, ABC, Eyewitness News, CBS, everybody, Spotlight New Jersey, The Print, Star Ledger did a feature. Tom Moran wrote about our high vaccination rate. Mike Kelly from The Record, Herald News, Jersey.com. So we utilized the press, I believe, we leveraged the press effectively to get the word out, and residents were responding. And then social media, look, that's me. And maybe I got to work on my biceps, but I am wearing my Paterson shirt to show people, look, I'm not only proud to be a Patersonian, the only home I've ever known. Perry, you like that one? But also I'm proud to get the vaccine and to try to motivate others to do the same. So whether it was Facebook, Instagram, Twitter, our website, we were just promoting this ad nauseum. And then television, like I stated, we filmed a commercial. We filmed a couple of commercials. We got another one coming out about our booster shot and advancing health literacy. But I just want to continue to underscore the fact that the pandemic is not behind us, not at all. And we're not going to do a dance in the end zone, salsa like Victor Cruz used to do with the Giants from Paterson, of course. We're not going to spike the football. What we're going to do is we're going to continue to matriculate down the field like Hank Stram of the Kansas City Chiefs used to say. No, we're going to keep moving the needle relative to the vaccine and how vaccine equals victory over the virus. And so having said that, I'm not spiking the ball, but I do want to punctuate this presentation by stating as of July 11th, 2002, our vaccination rate amongst adults 18 or older in Paterson with at least one dose is 99%. Thank you, Perry, for this opportunity.
Thank you. Thank you, Mayor. Thank you for your inspirational, enlightening, exciting, animated, amazing talk. And I thank you all for being here. I want to just sort of sum up some of the things the mayor said, and then I'm going to take some questions, which I have on the side here. But what I love about your talk, Mayor, is one, you are the embodiment of what I have been talking about this school for years, which is politics shape public health. And
thank you.
These notions that politics and public health are separate from each other is nonsense. And if we've learned anything over the last 2 years, is that when people lead with science and lead with the well-being of people in their heart and in their mind, you get the results like you're doing in Paterson. So thank you for that. It's also amazing to me how you bring to life for us so many of the concepts we teach our students, like the idea of, intersectional work across the sectors, the church, the mosque, the mayor's office, the schools, they all have to work together. That one solution is not from one sector. The best solutions happen all together. I think the other thing we have to do, and you've done it, Mayor, but we have to do even more effectively, is how do we harness business and industry even more than we have in the past to fight this? Number two, I love the idea of how you translate all of this work to people in real time. Like Michelle will tell you, when the press calls, I'm there right away too, because it is our job to get the message out and to get it out accurately to counter all the negativity and all the false information. And finally, this notion of diffusion, using your leaders, right? The people who have clout and power out there in the community, in the population to spread the word. So all of this is just amazing. And we got to get you on this adjunct role. Mayor, I'm going to start. You'd be amazing. Like our DRPH students, if Leslie Cantor's on here, just sign them up now. Mayor, I do something like, I don't know if you're familiar with James Lipton in the Actors Studio, and he always used to ask the actors, like, what's your least favorite sound or your least favorite word? So I have a question I ask. I've started a tradition, not as old as the civilizations we're from, only a few months old, this tradition. And I'm asking it to everybody in our series, which is, you clearly are doing work that's with and for the people of Paterson, with and for the people of New Jersey, with and for the people of the country and the world. The term public health is used sometimes, the word population health is used sometimes. How do you understand, Mayor, the difference between public and population health?
You know, it's interesting. I also want to dovetail on something you stated before. Cross-boundary collaboration is something that we really emphasize here.
Mhm.
And it's not just a message, it's a mission. So that's the way we view our role. And in speaking with public health and population health, the way I view it is, look, we're dealing with human beings. This is literally a life or death situation. I lost my Uncle John early on to COVID. He died on April 11th, 2020, on Easter Eve. We couldn't even celebrate, and I had COVID at that time as well. So, like I stated before, we have a moral obligation to protect our population. And this is how we do it. But Perry, it didn't help that you had somebody in the White House who was saying that this was going to go away, that it was only in China, or only one person had it, or you can use a disinfectant. And you saw how that turned out.
Yeah, that's
In fact, I think that cost him the election because of the ignorance, and ready for this, the fake news that he was disseminating. So leadership requires honesty, integrity, and credibility. You lose credibility when you make comments like this is going to go away. It's not going to go away. I give credit to Governor Murphy as well for updating us constantly. That really helped, in addition to what we were doing on the front line. And early on, Perry, we took it so seriously. My first executive order was March 13th of 2020, and then followed by March 16th. And we really closed down all non-essential businesses, especially liquor stores. And there was so much pushback.
I mean,
our argument is like, liquor stores, are they essential? They're like, well, people need to drink during this depressing time. That's what I was told.
Yeah, no, I think, Mayor, look, I mean, I think that, you've created an environment for people who feel safe. I say this all the time, like, because I live in Newark here during the week, I live in New York City on the weekends. And it's like, I feel safe in both these cities because I know when I go into environments that everybody in that space is vaccinated, right? And it's like, that's the kind of work you've been doing to help, like, really take care of the people in your population, because you're right. The false information has cost us many of these lives. And I'm, in the midst of it right now of trying to outline my book, a book I'm writing, which is everything we didn't learn from AIDS, like, which should have prepared us for this. Like, the same sort of mythologies about like toilet seats and like plastic bags now and all of the false information. It's not so different than 40 years ago. So what have we really learned, and what do we learn now moving forward, right? Because the next one's just around the corner for us, unfortunately, right? We know that.
And Perry, I might add, like, this is the new flu, right? The flu came from somewhere. We have to get flu shots. So for as long as you and I are alive, and many other people are alive, we're going to get vaccine. We're going to get the vaccine. We're going to get flu shots, COVID-19 shots.
I think we're going to get, I said to Brenda yesterday on Spotlight News, I imagine we're going to be in a place, I don't know, maybe not this year, but maybe in 2023, where we go to the Walgreens or the CVS or and it's like, or what, your local pharmacy, and it's like one injection for both. Because I think that's what's going to happen. Because it's not
Brenda Flanagan?
Yeah, Brenda Flanagan. Yeah. I'm a fan. Yeah, she's amazing. By the way, this Dean guy is like a gym rat. So if you ever want help with your biceps, I'm happy to help you. Let's go to the questions from the audience. The first question is, Mayor, of the 800 positive cases in one day, what percentage were vaccinated?
That's actually a very good question. What I was told was about 70% were vaccinated, fully vaccinated. When I say fully vaccinated, I mean like both shots or the one Moderna shot. Now, as far as boosters concerned, it's far less. As a matter of fact, my wife, and unfortunately last year I infected her when I had it. This year she got it, and my two daughters got it. My son didn't get it, and I didn't get it. And the public health office is like, you recently were boosted, so the odds are, since you had it, you got vaccinated and you got boosted, you didn't get it.
Yeah. The
So
message about the vaccine is really important, Mary, and I'm so grateful for you. Joy Reid last night on MSNBC started this new thing where she's bringing people who are not vaccinated on to talk to them, to try to understand why they're not vaccinated. They have somebody, a doctor there to talk to the person. And I think that kind of communication is great. Like, we don't know, Mayor, like, we don't know. Like, this is a new virus, who knows? Like, and so I say to folks, like I think you're saying, you want to do everything in your power to protect yourself, especially your kids.
yeah.
Right? Like those 0 to 4-year-olds, they're vulnerable. And we don't know what this virus does to them in the long run if they become infected. So let's protect them.
Perry, I also want to point out, when I was younger, seatbelts were not mandated.
Yeah.
And I remember with my parents, especially my mom, this, right? This, to protect us. No seatbelt.
Right.
Now you have a seatbelt for what reason? Safety. A seatbelt cannot prevent an accident from occurring.
Right.
But it can help mitigate the severity of the accident.
That's
So
right.
you won't be as injured. That's the vaccine. Vaccine cannot necessarily protect you from getting the virus, but if you get the virus, it protects you from being severely ill. It's about safety.
Right. And there's nothing that's and I think, Mayor, what's so amazing is like, there's nothing that's 100%. And I've used that seatbelt example a lot. The other example I always use for people is like, I remember when the whole thing about not smoking in restaurants was causing chaos.
Oh, yeah.
People go to restaurants still. They just go outside to smoke. And in fact, less people smoke. And my people, my ethnic people, my Greek people were like losing their minds about this, but they've done it too, and it's fine. So there.
By the way, you got me in the mood for some spanakopita. Why did you?
Oh, I can make it really well, by the way. I'll make it for you. When we get through this month, we have to get through this month. Okay, question two, Mayor. I almost called you governor.
Don't tell Phil Murphy that.
Well, he can't run again. If 99% are vaccinated, did I hear correctly? 60% of those hospitalized at St. Joe's are unvaccinated. Please explain.
Right. So we have 60% are unvaccinated. So I mean, they didn't get it. So that's a very good question. That's 60% of, I guess, that 1% that is not vaccinated. But also you got to take into consideration what I said. It's 99% of adults 18 and older. So some of those that are vaccinated or in the hospital unvaccinated could be children as well. And I spoke to the president of the hospital. He's saying their cases are not that severe, but for children who are under, let's say, 5 years old and they're in the ICU, it's because they may have underlying health conditions, which only exacerbates the situation.
It's not acceptable to me, Mayor. I don't know how you feel about this when the CDC, and then I love my friends at the CDC, but when the CDC comes out and says, oh, yeah, the people who are dying have 4 underlying conditions anyway. And I'm like, no, but they're also poor people of color. Like, why are they dispensable? Does that mean
no?
So it's exactly, and that's why I hate that message that came out the other day. This is a bad message.
We have one of the most vulnerable populations in Paterson. Our median income is like $30,000. So think about it. Like I said, people live in close quarters. So these are not optimal living conditions. And what also like compounds the situation, besides living conditions, is the fact that we are so densely populated, like I stated before. 8 square miles, 160,000 people.
Right. Well, that, and that's why people were like, oh, New York and New Jersey, like Northern Jersey, like horrible, they're spreading disease. Well, we live on top of each other. It's not like we're in Montana, right? Where we have acres to ourselves. It's like you walk up, it's really, I mean, I remember growing up in Queens, my grandparents were there, my aunts and uncles were there, my parents were there. We were all together in this congregate housing, and we can't help it in the Northeast. We're densely packed. So disease spreads. It's just probability theory. It's very simple.
Astoria?
Yeah, of course.
Of course.
Hello.
Greece capital.
Do you even need to ask that question? I mean, that's just a given.
Sorry, Perry. I don't assume anything.
Maybe if it was somebody younger than me, you would probably see like Bayside or something like that. But definitely Astoria when I was growing up. Here's my next question for you from somebody in our audience. First of all, let me actually read a compliment to you from our awesome Professor Emily Barrett, who's an amazing epidemiologist who does works with, with children and mothers, and examines how different kinds of environmental factors influence their health. But Emily says, this is such impressive work. I wish all cities had mayors who think as creatively and proactively as you. So a little compliment to you from
Thank
Dr.
you,
Barrett.
Professor. I have an excellent team, advisors, and like I said, the Bloomberg Network has really helped. And hearing from him directly, he spoke to mayors often.
Mm-hmm. Yeah,
He
no,
gets it. It's
he
all about
totally
getting
gets
it, right, Barry?
you just got to get it. You not only have to get it in your mind, you have to get it in your heart. You have to believe that people's lives matter, right? That that every life matters, and you do everything in your power to keep people alive. And I've said this all throughout the epidemic. I'm like, if you're not going to take care of yourself, think about somebody you love. And for me, it was always my brother, my younger brother who has MS, who's so vulnerable, right? I did everything in his honor to make sure that he stayed alive. And, did I see him for Christmas this year? No. But you know what? I'll see him next year because he'll still be here. And that's the gift.
Yes.
The question here is, what about the mosques and faith-based community? The reason I ask is someone we interviewed made the comment that the churches are helping in the effort, but the Muslim leaders aren't. Her words, her thoughts, not mine, says this person.
Not true. Unfortunately, that was an omission on my part in the presentation. Yes, there were a number of Muslim houses of worship, mosques, who opened up their doors for testing and vaccinating and even voting. I might add, that was the first time with early voting. One of our mosques not only did the testing and vaccinating, but they also did the early voting. And we made it a point that with the mosques, we would pick a specific mosque one week, get the congregation there. Like, for example, there's an Arab mosque, so attracting Arab Americans. And then we had a Bangladeshi mosque, and we had a Turkish mosque. So we put like I stated before, a full court press on the houses of worship.
Anyway, yeah, no, I think the houses of worship are, incredibly important. I think, again, anywhere we can go to spread the message, like, I don't care if it's like a athlete or a politician or religious, like, all these people matter. Like, I wish the Kardashians were out more about this stuff, but they're very busy. Those ladies.
Perry, it's interesting because I just read something where like Aaron Rodgers and Djokovic didn't want to get vaccinated or whatever. But I'm a Brooklyn Nets fan dating back to when they were in New Jersey.
Yeah.
And I feel like their season is going to come down to one shot. And I'm not talking about anything on the court. Mm-hmm. It's Kyrie Irving. Mm-hmm. And if he wants to get the vaccine, the one shot, Johnson & Johnson, I'll personally administer it for him, because right now he can only play on the road. We need him to play home games. So
let's get this on the record. And I think Mayor,
get it on the record.
Get on the record. I'm an enormous tennis fan. My buddy Leslie Cantor, who may be on here, we go to the US Open when we can. We talk about tennis all the time. If Djokovic plays, I'm not watching.
Oh.
And it's going to kill me for 2 weeks not to watch. But I just feel like, for me, that's like allowing him in when the rest of the country has to be vaccinated is just like not the right thing. It's just the wrong message. And it's
incongruent.
It's incongruent, and it's also about a white man's privilege, a rich man's privilege. And I don't like that. Here's a good question. What was your biggest surprise in terms of a tactic that worked much better than you expected? And what was your biggest negative surprise in terms of something that didn't work as well as you expected?
So that's interesting you say. There were many surprises. We've never done this before. There's no pandemic playbook. So it's like everything was a surprise, right? Like the mobile unit. I was like, okay, we'll put it here. Let's see what happens. And then you got like lines and you're like, whoa, that one worked. Now I'm trying to think of it. And also, like, when we were at the point of dispensing, that really, really worked. Like, we were on the cover of New York Times for having long lines, and the governor's office called and they weren't happy. They're like, stop, you can't have long lines like that. People are waiting in the cold. I said, but they're waiting in the cold because they want to live. That was a message that I continue to emphasize. But as far as like surprise that didn't work, I got to think this one through, because not that everything worked, but to get to 99%, almost everything did work. But obviously there's things that we could always improve upon. And I will tell you, the one thing I feel badly about is that our healthcare workers, they haven't rested. Since for 22 months, they went from contact tracing, testing, vaccinating, boosting. Now they're testing, contact tracing, vaccinating, boosting all over again.
Right. And you got I put in the chat, everyone, the New York Times article where they talk about Paterson, and I think I was interviewed about the mayor's efforts in that. And it's impressive how you did that, because contact tracing is not easy, right? You know it, and you guys did it really, really well.
Thanks.
So, and congratulations for that.
Well, Perry, I also got to point out, in April of 2019, my public health officer came to me and said, look, I want you to apply for this grant. It was only $95,000. So what's gonna happen with it? What is this grant about? Tell me. He says, well, in the instance that there's a foodborne outbreak, we can trace all the people that were in close contact with anyone that got sick. And we have a number of catering halls in the region. The primary one is the Brownstone, very famous. Actually, it was popularized by the reality show, The Real Housewives of New Jersey, and then the spinoff Manzo'd with Children. Yeah, that's
Michelle knows.
She does. So anyway, so we applied for this grant in April of 2019. In November of 2019, we announced that we got the $95,000 and we can build out what we would call our strike team. And little did we know, a couple months later, the strike team would be your contact tracing team. So it was a capacity building grant, and we took it from there. The rest is history.
Somebody was smiling down on you guys and preparing you. It's like, it was just, I just was watching the disaster of New York City happen, because that just went very badly. We could talk about that.
Governor Cuomo, or?
Well, let's not even go there. But no, I'm thinking just the city of New York did very badly, and it's like, it's just because I think what they did, Mayor, that you didn't do, is that they realized that public health is not medicine. That, but then the city of New York didn't know that, and they put all the medical people in charge and pushed the public health people aside. And one of our earlier speakers was was Oxiris Barbeau, who was the commissioner, who was amazing, who had to leave because she couldn't do her job. So it's unfortunate. Yeah. I'm going to do one more question for you, because we're almost time's up, and I want to be respectful of your time.
I'm thoroughly enjoying this, by the way. Thank you, Perry.
I love it. I love that you've done this, and I love that you've given us your time. It's remarkable for our students and for our faculty to
I appreciate this, sir. And like I stated, rah. I root for the football team. I just texted Greg Schiano. You got somebody off the transfer portal.
Oh, dude. Yeah. I mean, I'm a Columbia undergrad, so like our football team sucks. So
well, that was my alma. Well, that's my
your master's degree. Yeah.
Children, awful, man.
Awful, man. I could have been on the football team. All right.
Sorry, I gave you a raspberry on that.
No. I mean, I'm a good athlete, but not a good football player. What efforts are in place for children and pregnant women?
Yeah. So we have at the Division of Health, we actually have space for healthy mothers, healthy babies, and we try to emphasize that it's safe. I mean, we recruit like pediatricians to help us. My wife had concerns because both of our daughters, I have 3 children, but both of our daughters who are eligible had respiratory issues, but we consulted with our pediatrician. She said that it is fine to get it. They got the flu shot first. They're going to get vaccinated now because, like I stated before, a couple of weeks ago, both my daughters were infected with the virus. But look, this requires adult leadership. So as an adult, I have to be a leader. And I have to emphasize the fact that there's so many adults that got it. There's so many children that have gotten it. And we even, like I said, we maximized the media with children. We had some children that got vaccinated on television just to show people it's not as bad as you think. You know what doesn't help though, Perry? In 1976, you weren't even born yet, right?
Oh yeah, no, I have no idea what you're talking about.
There you go. That's right. So there was, I think it was like swine flu, and it emanated from New Jersey. And then all of a sudden, like they rolled out this vaccine. It wasn't ready, and people got sick. And Gerald Ford took it on television. I think his family as well.
I remember.
And that's why I think people were leery, because they're like, okay, look what happened in 1976, and I don't want that happening in 2020, in 2020. I'm sorry, 2020, 2021. So we were up against that. But I'd like to think that we're very resilient, and we're going to continue to be tenacious when it comes to getting over this fact, putting this pandemic behind us.
Yeah,
the virus is here to stay.
Oh, forever.
Whatever we think. And Perry, what doesn't help is that it's inequitable distribution of the vaccine. I think there's some countries that just didn't get the vaccine, and that's why you're seeing mutations, because in poorer countries, if you don't have access to this vaccine, it'll mutate.
Well, I so love everything you're saying, because, you know, one of the things that, you know, that I've been thinking about and we've all been talking about, it's like, okay, well, we can get Jersey under control, but it doesn't help like us when people from the Mississippi come into our airport,
Yeah,
right? Or the Alabama or any of those places.
red
And
states, Perry,
the red
sorry.
and it's true. And it's also the rest of the world doesn't have vaccine. Like, I mean, they're not vaccinated, they're poor. Even countries like Greece, the vaccination rate is like not great. So how are we going to ever get through this when we're traveling all over the world?
That's right.
It's a challenge for our lifetime. And I do remember, you're right, also in 2009, when the flu vaccine that year wasn't prepared for the strain that was coming out. And even all of us who got thus in the vaccination, we're still getting sick. So what I say to people is about the vaccine is exactly what you've been saying. It's like, no, it's not necessarily going to prevent you from getting it, but you're not going to die. And that's the key here. And you're not going to get other people sick. We're going to die, right? So it's like not only about your health, but it's about your neighbor's health. So Mayor, thank you.